Hello and welcome to Diabetes Connections in the News. I'm Stacey Simms, and every other Friday I bring you a short episode with the top diabetes stories and headlines happening now. And this will be a little bit of a longer episode because our top story is looking back at the American Diabetes Association Scientific Sessions Conference. Of course, I'm not going to recap everything here. Please check the show notes, diabetes-connections.com, to see links to all of these stories and to learn more. A single infusion of a new stem cell-based treatment helped 10 out of 12 people with severe type 1 diabetes stop using insulin. This treatment is made by Vertex Pharmaceuticals. They have been working on stem cell research for a long time, and it's an infusion of lab-grown islet cells. A year after getting the therapy, 10 patients no longer needed insulin shots at all. The other 2 were able to reduce how much insulin they needed. The treatment requires patients to take immunosuppressive drugs, which may raise the risk of infections or cancer in the long run. One question I always have is, what does severe type 1 diabetes mean? What they're referring to here is people who have hypoglycemic unawareness. They have no warning when their blood sugar is dropping to very dangerous levels. They can suddenly pass out or have seizures, but it's not another form of type 1 diabetes. Positive outcomes, 2 different studies looking at GLP medications for type 1. Semaglutide, with the brand name Ozempic or Wegovy, reduced glucose levels and weight among patients with type 1 diabetes and obesity in a 26-week double-blind trial of 72 adults. Those taking Ozempic spent more than 70% time in range, less than 4% time low, and lost 5% of their body weight at least. As for adverse effects in type 1, rates of severe hypoglycemia were very low. They were actually the same in both groups, 5.5%. And no cases of diabetic ketoacidosis occurred. Tirzepatide, which is the brand name Mounjaro or Zepbound, also demonstrating promising safety and efficacy in people with type 1. This was a 3-month study where people lost weight and were able to reduce their total daily insulin dose by 21 units on average. This was a retrospective study, though, and the researchers say randomized controlled trials are needed to confirm the benefits. And looking ahead, a daily pill looks to be about as effective as a weekly Ozempic injection at inducing weight loss and lowering blood sugar. This is in type 2 diabetes or for obesity. The name of the pill, if I'm saying it right, is orforglipron. Long way to go here for approval, but this and many other medications are being raced to market to try to catch up with the established ones. It is thought 1 in 8 Americans are now taking a GLP-1 medication. New study shows inhaled insulin is safe and effective for kids with type 1. This is mankind's Afrezza, which would take the place of rapid-acting mealtime insulin. Findings indicate that Afrezza delivers glycemic control comparable to injected rapid-acting. It was also associated with less weight gain and slightly higher patient and parent preference scores. Mankind looks to seek FDA approval to expand Afrezza's indication to children. They also want to evaluate inhaled insulin at diagnosis and in automated insulin delivery systems in additional studies. Sequel MedTech has a launch date for its Twist system. It's coming up quick, July 7th. The Twist uses Tidepool Loop software. The system will work with Libre and Sensonic's Eversense 365. That is the year-long implantable CGM. The company also struck an agreement with Abbott to integrate with their future glucose ketone sensor. Medtronic spins off its diabetes business, which will now be called MiniMed. And at ADA, they showed off their next tubed pump, the 8 series. It's about half the size of the current 780G, has no screen, and is controlled by a phone. They showcased their patch pump in development. It has a larger insulin reservoir, 300 units, and a longer wear time at 7 days. No timeline for that, but likely not before 2027. Beta Bionics also talking about a patch pump, a prototype shown. They're calling it Mint. This will last 3 days, take up to 200 units of insulin. And you will hear from Tandem in our very next episode. It's out this Tuesday. They're working on a tubeless option for Mobi and a separate patch pump. We've talked about this before, called Sigi. It will be rechargeable and come with pre-filled insulin cartridges. And the T-Slim X3, also still in the works. Eversense CGM in the mix, showing off the plans they shared with us just a couple of weeks ago on the podcast. Right now, the Eversense can stay on for a year. Next up is Gemini, fully implantable, so no charging, but still needs a transmitter on top. And then further out is Freedom, which would do away with the transmitter on top of the skin. Everything would be underneath. Once weekly basal insulin looks just as safe as daily basal in people with type 2. This is Lilly's Efsitora insulin. Novo Nordisk's version has received approval for use in adults with diabetes in the EU and by Canada. Both companies hope to get approval in the US. Dexcom announces what it calls enhancements to event logging. You can add a photo to your meals and AI will populate meal descriptions. It will not carb count, but it will identify the food. I've seen some demonstrations of this. Seems to work pretty well. You can also log exercise and see how the food and the activity are impacting your blood sugar. I can't wait to ask Dexcom about this. I've got to believe they are using all the data here to work on a carb counting AI app where you would just take a photo and get the carb count, or you take a photo and an AID system would just know what to do. That's my speculation, but we shall see. A research panel at ADA urging doctors to screen people with type 2 diabetes or prediabetes for a liver disease triggered by accumulated fat in the organ. It is called MASLD or MASLD, often has no early symptoms, can progress to cirrhosis, liver failure, and liver cancer without early diagnosis and intervention. But early intervention can reduce and reverse the risk. Some individuals with type 1 who have obesity are also at risk. And finally, Axiom Mission 4, which lifted off this week from the Kennedy Space Center, is looking at the future of space travel for astronauts with insulin-dependent diabetes. Very small first step here, but exciting that it's happening at all. The Sweet Ride study is going to test CGMs in space to ensure their accuracy in microgravity, providing real-time data. The mission will also look at insulin exposure in microgravity to assess the potency and stability of the drug product upon its return to Earth. And that is it for In the News. Quick programming note. In 2 weeks, when we should have another episode, I will be at Friends for Life. So we're going to try to do the episode anyway. I might do it live, but it might be a wash. That conference is really busy. And unlike ADA, it's not a place where companies are releasing new research and showcasing studies. It is much more about community. So I'll keep you posted on social, let you know what the plans are. But if we do not do In the News for its next scheduled date on July 11th, it'll be on July 18th. But of course, follow on social for any breaking news. We'll try to bring you the latest. Thanks so much for joining me. I'm Stacey Simms. I'll see you back here soon. Until then, be kind to yourself.
Diabetes Connections is a production of Stacey Simms Media. All rights reserved, all wrongs avenged.